Now, today, what happened? 4 Republicans split from their party, sided with Democrats to force a vote to extend the ACA subsidies. One of them is Pennsylvania Republican member of Congress, Ryan MacKenzie. First of all, Representative, thank you for joining us. I appreciate you taking the opportunity. And let me just say, thank you for putting your constituency first. I know we've looked deep into your constituency. I know that there's a lot of political risk in this, but you're putting your people first, and I respect that.
Well, thank you, and that is what this is all about. Our friends and neighbors have been facing unaffordable health care for far too long, and the spikes in prices that could be potentially coming for many people are simply unsustainable. I heard from a small business owner, a supporter of mine on the campaign trail just yesterday about what he is facing for his family. It went from $399 up to $931 for the exact same plan. And so he said without the extension of the tax credits, that means for him that he is potentially just going to have his family go uninsured and hope nothing happens. And then maybe Congress actually takes action and he could re-enroll in a plan in the future. That is not a great outcome for his family and something that we're trying to avoid for so many across our district.
And small business guys like him are dealing with tariffs. As you know, if he's bringing anything in, especially from China, you know, his debt burden has gotten higher. So I get the stress and strain, but there's stress and strain on you too. That's why I laid out off the top. This is not Trump's thing. You know, he didn't create the problems with health care. Yeah, he could have done something about it, but Democrats have been in power also, and costs have just kept going up. Do you believe that that message is getting through? The subsidies are the easy part here. Let's be honest, Congressman. It's going after these corporations and why they hold us hostage with the cost structure.
Well, that's why we have said all along, those of us that are in these bipartisan work groups that have been talking about reforms, that we need to do not only a short-term extension of the tax credits to help relieve cost pressures right now, but we also need long-term reforms that are actually going to bring down those prices for everybody. So we hear about pharmacy benefit managers and how they're driving up costs for prescription drugs. We need to reform that space. We certainly need price transparency for our hospitals so that when people do go for an elective procedure, they can actually see and compare different costs from different health networks. We need to make sure that price things that aren't going to happen to them, like surprise billing, when they get a bill out of the blue on something that they weren't expecting, but the hospital has added an additional charge. These are all different things that are actually available to us as legislators to put in a reform package so that, again, not just the extension, which will help us in the short term and is very meaningful to a lot of people, but we need these long-term reforms that are actually going to reduce the cost of health care.
You've got to go after the people that Donald Trump said could not own him. The rich and the powerful in these healthcare corporations and the insurance companies. They put in the most money to lobbying when you put them with their financial backers. And these are the guys who he said he could take on. You heard my ideas off the top. I'll look forward to hearing his, but I really do believe, you know, everyone says the president does too much by himself. Congress should have more role. This is it. This should be on you guys, and I appreciate what you did today. You're always welcome here, Ryan, to discuss ideas on cost. Last word to you. On the president, I'm optimistic about what he's going to present, and the reason why is twofold. First, we have seen him take on the drug companies with most favored pricing status, actually forcing them to bring down their cost. That's something that everybody said wasn't possible. He actually went out and did it, and I think that's something that he needs to be commended for. The second thing is J.D. Vance was just in my district yesterday, and in front of a crowd of hundreds of people, a member of the local press asked him and said, Ryan MacKenzie supports extending the ACA tax credits. Where do you and the president stand? And he did not say that they were opposed. He said what we are in favor of is whatever can get through Congress and get to our desk to help bring down costs for people. So we have that task and responsibility in Congress to try to get something to them that they can actually sign into law. I agree, but with respect, Vance ain't Trump. He can say that we're for whatever it is. It's not good enough for the president of the United States, and I don't think he would say that. But I do think if he takes an opportunity to say to you guys, the cost structure is too much, the subsidies are necessary, do something about it. I mean, I don't know. I think it would be an opportunity to get this country having a chance to move to a better place. Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.